I'm extremely happy to welcome you all to the second day of Episteme 2022, online international conference organized by Department of Social Work, Sree Sankaracharya University of Sanskrit, Kaladi, Regional Campus, Payyanur. Here we begin the first session of the day. Today's session is based on the theme, is the current social work practice poised to address the developing challenges and opportunities of the new normal? Reflections of a practitioner. We have beloved and honorable speaker, Mr. Aloysious James, to share with us. And also we have Dr. Boban K, Assistant Professor of Sree Sankaracharya University of Sanskrit, Kaladi, to moderate the session. Now I invite Sharias K, my own colleague, to welcome the gathering.
A warm good morning to all. It's great privilege for me to welcome you all to the third session of Episteme 2022 International Conference organized by Department of Social Work, Sree Sankaracharya University of Sanskrit, Kaladi, Regional Campus, Payyanur. Let me take this opportunity to welcome Mr. Aloysious James, who is going to talk on the theme, is current social work practice poised to address the developing challenges and opportunities of a new normal, reflection of a practitioner. Wholeheartedly, I welcome you to the conference and the session. I welcome all the faculties, scholars, and students of different universities and colleges present here. This event would not have been possible without the continuous efforts of vibrant team. Here, with immense pleasure, I welcome faculties and students of Department of Social Work at the Regional Campus, Payyanur. Once again, I welcome you all to the session, wishing you all a delightful morning. Have a great day.
Thank you, Sharias. Dear all, I'm reminding you that the feedback form will be shared in the chat box at the end of the session. Please do fill it up so that we can provide you the certificates. Now we have come to the major part of our session, the thematic presentation by Mr. Aloysious James. Before moving on to the session, let me introduce our honorable speaker, Mr. Aloysious James. He is an experienced development and humanitarian professional with a demonstrated history of working with the United Nations and the non-profit organization. Also, he worked with International Organization for Migration, United Nations, and 4 other international organizations in managerial and leadership capacities. There was his active involvement internationally by managing the people-based development, humanitarian response, and climate resilience program. He played a lead role in responding to the Syrian and Rohingya refugees and the tsunami, Nepal earthquake, Thailand floods, and the development programs in the Asia region. He provided a strategic leadership role in Nepal, Bangladesh, India, Jordan, Lebanon, Afghanistan, Thailand, and Cambodia on implementing and managing climate resilience, disaster risk reduction, and humanitarian response programs. He is currently engaged in coordinating the documentation and publication of 20 years of a public health program in Sundarbans and international consultancies on development and resilience. And professionally, he qualified from Mahatma Gandhi University, Sheffield Hallam University, Bangalore University, and Johns Hopkins University. Indeed, we are honored to have you, sir, speaker for this session. Now I invite Dr. Boban, sir, to take up the session. Over to you, sir. Thank you.
Thank you, Ajmala. Am I audible?
Yes, Boban.
Okay. Good morning, everyone. Good morning, Aloysius.
Good morning.
Good morning, Anita Miss and all. Okay, this is an immense opportunity of expressing my gladness and joyfulness to participate in the Episteme. I think this is the season 3, no, Miss? Which has become an icon program of Department of Social Work, offering from Regional Center Payyanur. And I am using this particular platform to invite Dr. Aloysious to handle this session. We know we are going through International Social Work Day every year. And every year we are organizing the event very colorfully with new episodes, with old practices. And the question remains, even though social work with its deep scientific knowledge base and other facilities and all, now social work is almost qualified to analyze and intervene to help our society to make substantial changes and to face the challenges also. So in this particular phase 2, we were still facing a question whether the modern social work is poised to address the developing challenges and opportunities that are become usual to our global scenario. So we know very well challenges are many in front of us: disasters, pandemics, global climatic changes, then food and health inequalities, violence of varied kinds, then social isolations. As we all are sure, it is the time to address how we can tackle the emerging these social issues in the adverse phase of mankind through social work responses. So here is a person with humanitarian and international exposure with the people-based development responses, Dr. Aloysious James. So we can directly to the words of the experts with a lived experience. We are handing over to you, sir.
So you're muted, Aloysious.
Yeah. So good morning, and thank you, Dr. Boban. And it's happy to be here to meet all of you, especially the students of social work, the academicians, and some of the practitioners. I can very well see Vivek there, who is also was also one of my colleagues when we were working together. This particular conference also reminds me about my college days during my social work time at Rajgiri College. And it's again a privilege for me to be part of the process. Just wanted to talk a bit of my experience while working at the national and international level in the humanitarian development sector, and how I looked at social work and probably what are the challenges we faced. And now how this social work profession at the moment is helping or likely to help in the COVID scenario or the new normal, what we call it as a new normal at the moment. And as you all know, that social work is at the moment is happening very much in a disruptive world.
Excuse me, sir. Sir, I think your voice is disturbing and of low level.
Is it audible or still echoing?
I think some disturbance are there. Still it is clear, okay. No problem.
Sir, should we present the PowerPoint from our end?
Yeah, that may be.
Okay, we'll do that, sir. The slide is visible, sir. It's come.
Yeah, for me it's so visible at the moment, audible at the moment. Yeah.
Yes, sir. It's clear right now.
Okay. So I'll be talking a bit about some of my experiences working with in the humanitarian development sector. And just trying to go back, we'll go to the next slide. Yeah. The focus is going to be around the current social practices, whether it is poised to address the evolving challenges or developing challenges. And what are the opportunities at the moment? Let's go to the next one. Next slide, please. Yeah. I mean, almost 2 years now, we have this whole Corona-19. And probably, I think last week of 2020, 2 years back, I think the same time, officially it is declared in India as well as at the national level, though it started a bit early. And we have the number of cases, something like 460 million people at the moment affected by Corona. And the number of people died, if you take it. Next one, please. The death is something like around 60 million people. We have maybe 393 million people actually, they say it is recovered from the COVID context. This is based on the Worldometer report. Okay, move on, let's move on. Move on. And we have seen the impact of COVID-19, a lot of loss of lives and livelihood. I mean, we don't need to mention, okay, how many people got affected on that one. There is an increase in inequality and injustice at the moment. And all the inequalities which was existing earlier got exacerbated at the moment. And you can see the issues faced by a lot of people, especially the marginalized and underprivileged people. The home confinement and on quarantine, basically that created a lot of health issues for the people, especially mental health issues, depression, anxiety, I mean, so many acute stress or whatever it may be, call it as. The social stigma, especially being known as a COVID patient, probably sometime back it was seen as a social stigma, and you had also seen how the people are responding to those situations, especially to those people, how they were excluded from the communities. And it created further psychological problems. And a lot of misinformation and communication at the moment going around with COVID. You can see the WhatsApp University at one level. At the same time, you can see very organized groups from different parts of the world actually giving a lot of misinformation regarding the COVID, the type of treatment, and probably how to respond to that situation. All those things are happening at the moment. And which is also further leading to polarization of the society. There is a tension at the different levels. There is a pro-vaccine groups. There is also a group very consciously promoting, especially for the extreme right-wing groups, which is trying to bring in a lot of other dimensions, especially the religious dimensions into this one. So there is a lot of tensions happening, and there is a lot of polarization happening within the society. And we have also seen that actually at another level, it's happening at the moment. A lot of people lost their livelihood, and the new technology which is emerging at the moment, especially the AI, the robotics, the automation, everything, that brings in a lot of threats to the existing working people. And increased social isolation, especially they have been depending quite a lot on the internet and probably the social media that reduces their actually social well-being and also the pro-social behavior. So it basically helps them, incapacitate them to interact with the community, especially in the open space. They're quite happy at working with the media at that level. And you have also seen a lot of unrest and uncertainties in the last 2.5 years, actually. because of the stress factor, because of the loss of jobs. I mean, so many other factors are there. And one important dimension is the privacy factor. I mean, your privacy is no more there at the moment. I mean, wherever you go, you are trailed. And it also helps actually the government, though they don't want to be like that, probably moving to the authoritarian style. I mean, they want to practice at that level. And many organizations, many government who are already authoritarian groups, in the pretext of security, or the risk of the society, they also try to control, monitor the people's movement, especially those people whom they have already in their list. And you have also seen that the education inequities that existed in the pre-pandemic, it got further accelerated as a result of the COVID-19. Let's look at what we have done, especially I'm mostly talking from a social worker's point of view at the moment. We were not ready for it at the moment. When the COVID came. It's a pandemic, it's in a massive scale. It affected the whole world. And though we were not ready, we fought valiantly against the COVID. We saved lives, we created alternative livelihoods. We ensured people, they meet their basic needs. Provide a lot of psychosocial support. We gave awareness, education. We work closely with the government. I think that is one of the added value. We worked with the government. We mobilized a lot of resources by ourselves and also with the support of other agencies. There are quite a lot of volunteers who also contributed for that one. And what happened, because we were not ready for that, we exposed a lot of our strengths and also our limitations. But we learned from that one and we moved ahead. And what's happened at the COVID time, maybe some of the developments based on my experiences. See, what happened, especially from the health point of view, look at it from the health point of view. A lot of people, they said, okay, they don't want to go to the hospital anymore. They're happy with the telehealth services. And the McKinsey's, based on the study, they say that, okay, the telehealth care was 38 times higher than the pre-pandemic levels. Yeah, please. Please, go ahead. And one interesting development is that actually something like a 265 million in Medicare that will be shifting towards patients' homes by 2025. That means you will not be finding many more hospitals coming up, whereas a lot of their funds and resources will be mobilized, providing telehealth and also providing home-based treatment part of it actually. And that is going to be the future in the health sector. And you have seen a lot of virtual health services at the moment happening. Everything is tele at the moment. If you look at it, tele, everything is accepted. That is and progress. It is telework. People started working from remote. Telemedicine. We call it telejustice. I mean, including the courts, the law and order situation. They also started operating remotely. Education is tele, remote. And the schooling is virtual. Education is mostly the students. There are students who have not attended the classes for the last 1 year offline classes. But probably, of course, recently they have started all those things. But otherwise, it is mostly online classes. And you see what's happening with the e-commerce at the moment, actually. Everything people, they order online. And we don't like to go to the shops and do the shopping at the moment. A lot of remote working opportunities at the moment is happening. And probably there is a major shift within the companies also to organize remote working opportunities for the people. And I'm one of the privileged person in that way. I'm operating from home. And for the last 10 years, actually, we never lived together as a family because my kids were living in different places. But now four of us are staying together. 3 of us are working from home. So it gives a completely different feeling at the moment for all of us. So for us, it is again a blessing in disguise, while for many it is a curse. And we have seen that, there is also as we are talking about the social solidarity part of it, but a lot of big support is coming from the various actors in supporting the COVID response part of it, actually. A lot of support is coming through the online and offline. Equally, there is also a counter movement. There's a rampant misinformation happening. You can see it probably happening in America. You can see it happening in different parts of the world, actually. Especially the neo-Nazi group, they try to get the recruiters for them. And there is also the increasing authoritarianism in the pretext of COVID management. You can see that, people have been watched and their movements have been watched at the moment in the pretext of security and safety of the people. Yeah, moment. See, what's happening is what all this happened so far, we cannot go back from that at the moment. And everybody dreams about a situation, after the COVID, I'm getting back my normal life. Look at situations like travel. The way we travel earlier, I think it's completely different now. We always think double or twice, actually, whether I need to travel at the moment or not. So we don't want to travel. And there are occasions, for a 2-hour presentation, people used to travel 6 hours to travel even by flight, actually, remote place to other places. But now I don't think that's happening. Now we can also operate from home. We depend on Slack, we depend on Zoom, we depend on Google Meet, actually, to do our presentations, to our meetings. So travels are reduced a lot, quite a lot. For the last 2 years, I have not traveled outside of the world, India. So which itself is an indication, how much travel we have reduced. I'm a person who used to travel quite a lot in the past. For the last 2 years, no travels at all. And I think twice whether I need to travel at all. The way we looked at celebrations and entertainments just completely changed. The crowds were there actually for the celebrations. And the entertainment, we had a lot of fun, but those things are reduced. Now, there are stages where we had only probably 10 people, 15 people allowed to come together. There are situations, not more than 5 people were allowed to come together. Even family get-togethers were not allowed at certain time. So all those things have changed. The privacy, as I already mentioned, actually the privacy is affected. All your movements are controlled. When you travel to another place, actually, you enter in using an app and all your movements are taken care of, are actually monitored. And they know that where you have gone and probably whom you meet and what is the purpose of your travels and all those things. Healthcare, you don't go, as I already mentioned. Very reluctantly, we go to a hospital now. Many of the hospitals at the moment, they consider to be providing COVID rather than treatment. So people are afraid to go there actually, whereas there is an increase in the telehealth part of it actually. Offices as work locations. So I don't think any any companies at the moment will invite people to come back to their places and work from there actually. So a lot of changes has happened there. The schooling. The whole education system is going to be changed. However, that is changed at the moment. Livelihoods and economy. Many of the traditional livelihood opportunities that is completely off. Maybe new opportunities emerging at the moment. Economy is affected. But at the same time, there are certain companies which huge profits actually because of the COVID situations. So even the whole pattern, the systems, everything is changing at the moment. Yeah. And from a social work point of view, let's say what are the changes happening there actually? The social work practices are emerging at the new social work practices are emerging. If you look at care and support, actually, that is one of the major activities of the social workers. Especially if you look at the Western countries, actually US or UK, the care and support it is mostly doing the case studies, group work, or providing care to the people, or looking at the children, or probably foster parents, all of those things. So that have been completely changed. We try to follow them, monitor them remotely. We don't interact with them directly on a face-to-face basis. So that is completely changed. So the way we interacted, the way we provided care and support, that is changed. The way we interacted with individuals and groups, that is no more there. Sorry, it is there, but it is completely changed. And there is doubts even within the social workers whether I should meet them personally, or if there is a facility available at the moment, even talking to them on a Zoom, or probably talking to them or Gmeet, or maybe WhatsApp. I think we try to work at that level. Community mobilization is supposed to be one of the core activity of the development people, especially the people believed in the community development process. We would like to meet them personally, talk to them, create awareness, mobilize the people around that one. But we do the community mobilization in online at the moment. We don't interact much with the local community. We don't interact at that level. So there is a shift happened even in the community mobilization process itself. The training programs. We do the training mostly in Zoom. Or there are a lot of other opportunities at the moment. Slack is there. GBT is there. So it is mostly virtual training programs. So virtual training programs, it's one way it is good. At the same time, there are also limitations at that level. But the whole idea is actually that the way we train people, that is changed. And we depend quite a lot on this augmented reality, AI, and all those things, even within our training programs. Even to give an exposure to a situation, now the technology tells us that we don't need to visit those places actually. With augmented reality, okay, you can see those places. Even for experiential learning, you don't need to go through the physical experiential learning. We can also do this through the gamification or the augmented reality part of it actually. So things are changing even in the way we operated in the past, especially even from the social work point of view. Yeah, please. Next one, please. There is another challenge is actually the way people participated in our process actually. For us, it is a participation is also how much they are able to influence the decision-making process, how much they are consulted, how much their views are taken care of. The whole participation methodology itself is changing at the moment. Participatory training methodology is changing. Participation in the decision-making process is changing. Participation in the discussions, dialogue, all those things are changing. The whole empowerment process is also changing at the moment. So we need to come up with probably very innovative methods actually how to ensure people's participation, and especially participation of the most vulnerable and marginalized communities. I think that is also a challenge at the moment. And the way we empower them actually, we need to understand, okay, what is the difference we are making through the new processes, and probably may have to come up with the creative ideas through the participation and to ensure the empowerment of the communities. Similarly, the whole mental health support program actually. We can do the e-psychotherapy at the moment. We can monitor the person on a day-to-day basis, or 3 times a day we can monitor the person, what's happening to them. There are cases, okay, there are a lot of case studies are there actually. People or the social workers are actually following people on a daily basis and in a completely different. please move ahead. Yeah. Now, so I was talking mostly about actually what has happened. Probably the COVID came and how we responded, and there are things which we cannot go back to the past anymore, or we cannot practice the same way as it is. So what we call it as a new normal, which has already come there. Now let's look at social work practice. What's happening at the social work practice? Social work mostly it talks about social change. It loves to bring changes in the lives of the people, lives of individuals, and also in the society, and society for the betterment. And social work profession is also committed for the social justice. That means the most underprivileged people, their voices are taken care of, their needs are addressed, and there is a response to their concerns. They get an equal opportunity like any other people. So there are a lot of people who doesn't have the voices, they get doesn't have voices. They get the voices through us, or we facilitate that process through our empowerment process, or probably linking them with other actors, or maybe through social advocacy programs, whatever it may be. And we are also into life-saving activities. So social work practice, we believe in individual changes, we believe in social changes, and it is rooted in social justice part of it actually. And we also help the clients and the community to access services. We facilitate those processes. Yeah. And we promote social justice, which I already mentioned. Yeah, please go ahead. See, it's important to look at what's happening in the social work profession. It's an evolving profession at one level. You can see
Hello, sir. Sir, we can hear you. Hello, sir. Are you there?
I think his connection is lost.
Yes, sir. I think there is a network issue.
Yeah.
Actually, we are contacting him. We can wait for some time.
Okay, Ashmara.
Dear participants, sorry for the inconvenience caused. Our resource person will join soon.
sorry.
Yes, sir.
Yeah, I'm sorry. I think there is a disconnection of the network, I think, here.
That's fine, Aloysious. This is a new normal, so we are used to this network issues. So please proceed.
Yeah, that's right, actually. So what's happening is there's quite a lot of changes happening in the social work field itself. Even the social work profession itself is recognized differently in different parts of the world. The global south, and probably if you look at the west social work is seen in a completely different way. It is mostly from the care and support angle, especially from the US and also mostly from the looking at the European context. Actually, the profession gets energy from that perspective. Whereas mostly in the south, it is mostly coming from in addition to the care and support, it's mostly coming from the community development process, actually, the social mobilization process of it, all the integrated development part of it, actually, it is coming from that perspective. So certain countries is more valued, certain countries it's not valued. I think that is a, yeah, please. Yeah. So here we give a lot of importance to the community-based approach than the individualized approach. And it has got more acceptance even within the social profession for such a process. I'm not demeaning the other one. It is there, it is very important, but at the same time, we get more recognition and acceptance because the third world countries, we involved in the development process, actually. Please move on. See, and the other side, what's happening with the social work practice at the moment? A lot of digitalization is happening at the moment, digital engagement for the social work practice, which is not new. It was happening earlier also, but I think it got accelerated further during this COVID time. And I remember when we were working in Amman, Jordan, during the Syrian crisis, actually, our team members, they used to have groups connected to their telephones. I mean, they used to have support systems actually to the clients through the phone. Any problems they have, they used to connect them. And I have seen a lot of things happening in Bangladesh, even update information, probably surveys and a lot of things, digital level, we started working. So the online social work is coming at one level, which is formally, and also there is a blended version at the moment. But it all got further accelerated during this time, COVID time. And if you look at actually what's happening globally in the digital context, next slide, please. So you can see only 63% of the people are actually connected with the internet. They have the web services. Probably 2 years, 3 years back, it was something around the 43%. Now, at least now the last 2 years, there is a big jump. 63% at the moment. And if you look at actually which are the countries, and if you look at it is in African context, it is only 33%. Whereas in Arab countries, it is something around 66%. So it again, depending on the countries, even depending on the region, the digitalization process is also a challenge. We can't reach out to most of these people in this part of the world because they are not connected to the internet. Yeah. And it is going to be further exacerbated in even the coming years. Though there are 2-3 dimensions actually at the moment. At one level, accessing these facilities, accessing digital services. There are limitations for that one. That's at one level. And it also depends which part of the world are you in. Probably people who are in certain parts of the world or certain parts of the cities, okay, they get a better access. If you are in a remote village, you don't have that one. So that is one going to be a major challenge. So, and thirdly, there is also another dimension, a person whose family who is not digitally literate, or even the parents who are not digitally literate, they have less opportunities to connect with the world because they don't understand what we are talking about. So that affects even the education process. Quite a lot at the moment we are investing on digitalization, especially for the education part of it, online education. First of all, the equipments are not there. They are not able to access because they have limitations, because the infrastructure is not there, or they don't have the equipments and all those things. So this is going to be a major challenge. And the same thing happening for the social work context also. How do we reach out to those people who doesn't have mobile phones or the laptops or the tabs? Then there is another challenge. I mean, how do we do groundwork? There are certain cases we need to have groundwork, especially when you deal with the child abuse. We need to be physically present there actually. So we cannot do completely digital most of these things. Or if there is a domestic violence, we need to be there. We need to be present there actually. And then social work profession is also having a lot of ethical issues, moral dilemmas, even for this whole digitalization process. Because a face-to-face communication is supposed to be one of the golden, or supposed to be the human golden standard for building human relationship. And the way I connect with all of you and the way I connect with all of you in a classroom is completely different. My one-to-one personal contacts, that relationship, the degree of that relationship probably is likely to vary when I do it online and when I do it physically. So there is also a challenge and also a dilemma for the social workers. Though we believe that, okay, face-to-face relationship is important for us, but we can't do that one. So how do, and our relation, we have certain relationship over the phone at the moment, or probably the social media, but it may not be probably the degree of the relationship also may vary. It helps us to chat, text, video, online, etc. But the level of relationship also may vary. So we need to look at how we are going to change this situation, how we are going to address this challenge. Then there is also another dimension of the whole data management part of it actually. A lot of data information is coming about people, their privacy. And there are a lot of people who like to get this data, this information from us. And the data we collect, is it safe, secure? Do we have the technology to make it more secure? So then there are issues about confidentiality, especially if we are dealing with the individual's clients. Issues of when you do an online support system, probably you may be sharing a room with somebody else and probably the confidentiality issue is also getting affected there. Or people can overhear what's happening there. Then the other dimension is also the work-life balancing part of it. People who used to have certain boundaries, okay, it is 9 to 6, okay. You don't connect with your, you don't talk to them over the phone. But now in the present context, anybody who is affected, they can also get back to you through your WhatsApp or maybe through any media. It's a 24 hours program. And that is going to affect the social workers. And also, how do you find a balance between this one, the boundary, creating a boundary for that? Can you switch off your phone after 5 o'clock? Can you switch off probably your tab, probably laptops after 7 o'clock? There are challenges around that one. It does work. So it's a 24 hours, 24/7 program for us, for the social workers. Next one. Yeah, challenges again, providing social care from the therapeutic work. See, as I was mentioning earlier, you can connect with your client anytime. You can monitor them anytime. And you can connect with the person from any part of the world. I think that's more important. So it's not only the local folk thing at a different level, actually, at the global level. Also a globalization process happening. If anybody from any part of the world, actually, if I'm a client, so that's also happening. And there is an online community building process happening with this one. I mean, we have been part of support, probably Slack or other things. But this is also an opportunity to build your communities. There is a very good example in China, in Beijing, of people. A group actually, they tried to bring together for the gardening in the urban areas. They started in Beijing, that one. They brought together people who are isolated, who are on quarantine, who cannot go out. So people get bored with that one. So the two people, they tried to bring these people together in the with the help of creating a garden in the balcony. Probably it could be the maybe the seeds. They try to come together, talk about how they are nurturing, or they are trying to give tips to that. There's a relationship built up around these groups. Started talking about other issues, so that also became a psychosocial support for those people. So there are different methods. The online community building process also is possible through this one. There are a lot of work happening through social advocacy. And we have been seeing those developments in the past 4 or 5 years. So there's also an opportunity. Now, for me, actually, there are certain shifts are required in our practice. At the moment, my general feeling is that, okay, we are in a very comfort zone. There is always a challenge between, okay, whether we want to deal with the case. When you're dealing with, or maybe selected groups, we are not getting into the real causes of it, actually. Why these things are happening in the society? Why certain marginalized people, they don't have voices? Why they are not getting services? Why there is an exclusion of certain communities? So those challenges always there, actually. And a lot of people are comfortable actually addressing probably the case part of it, actually, rather than moving into the cause. When you move to cause, it's very challenging. We are talking about social change. Of course, the other one is mostly you're ameliorating the personal suffering, but here we are talking about social change. So we are confined to personal level, not in the social action, not in the social advocacy, or not in the forming alliances for social transformation. A majority of our social workers are at that level. I think that is a challenge. How many of us are actually social workers are really into social action? Unless we bring changes in the existing structures, systems, the inequalities, you will continue to ameliorate the problems of the individual, which is caused by these inequalities and social structures. We are very comfortable working as counselors, case workers, or childcare supporters, or being an administrator, social welfare administrators, which basically maintain the status quo. And you just follow what the bureaucracy says, actually, or what the system says. So it is managing the status quo. We are happy with that one. It's okay. But my question is that enough? There is also a need to go beyond that one. There is a need to focus on the social systems, structures, we need to look at the social and political inequalities happening in the society. And a lot of these are happening probably in the global south by the social workers, but it may not be happening mostly at the other part of it because the focus there is mostly on individual basis. Even here also in the global south, the professional social workers, they try to get into the very comfort zone, addressing the individual care part of it actually. Very less people working on the social advocacy, social change part of it actually. And you as social work students, when you come out of your colleges, your course, what do you like to pitch? You like to pitch it as an administrator in one of the institutions, or you want to be a change maker or a facilitator for change, working at the social issues? You look at Kerala, look at India, there are a lot of issues which you can get involved. But it's easy also, you can get back to an institution as a school counselor or a hospital counselor or a social counselor anywhere. So I think those are the challenges, or probably those are the challenges social work is facing. And that is why we are not getting proper recognitions and also maybe appreciation within from the society or even from the larger society. Even in the COVID time, we've done quite a lot of work, but the appreciation, most of the appreciation goes to others. Of course, they were the frontline people, the health workers are there. Equally, there are community mobilizations. I mean, a lot of processes happen with the social workers. How much of those things are appreciated, recognized? So that's a time for us to reflect at the moment. Next one, please. Maybe, are we looking at some of these things? I mean, shifts required. Sorry, Shiva Prasad, you were saying something. Can I proceed?
Sure, sir.
Okay. See, there are a lot of new issues that are emerging. I mean, you can come back to me if you have or if you have a question, please raise your hands. We can look at that one now. See, there are a lot of other issues that are emerging. You look at climate change at the moment, which is coming up. Disasters and conflict, which is quite common. Kerala never thought, okay, we will have disasters. But for the last 4 years, we have been facing disasters. Conflicts in a different way, it is happening. And we are all started actually facing the climate change issues. There are a lot of social movements happening globally, nationally, even at the state level. How many of our social workers are part of that one actually? So inequalities, increasing inequalities, economic shifts, probably 70% of the assets are actually managed by probably 10% of the society. So which creates further the inequalities. The gender dimensions actually, which is again a major agenda at the moment even for social workers to look at it actually. It's not only the issue of women, but also the issue of transgenders or anybody who is seen from a gender perspective, especially who is discriminated from a gender perspective. A lot of misinformation campaigns, issues related to trade, security. You can see the migration happening, probably even at the national level. We had refugees. Now we also have environmental refugees because of the climate change. Nobody talks about those people. There are people who have been asked to move out of their own houses, maybe in the context of development. And how do you support those processes actually, their needs? And probably these are all in addition to the traditional childcare, mental health, poverty-related issues. Okay. So there are a lot of new areas that are emerging at the moment for social work practice, and are we ready to shift our focus to those areas also? Next, please. So I think one or two things need to happen. One is within the social work practice itself, the architecture itself, we need to redesign. Probably we may have to relook at actually how it is actually taught. The whole pedagogy need to be relooked at. Why a lot of our people are actually only going back to individual care related things, why they are not moving into social change, when there is a lot of demand for those areas. So we need to redesign the social pedagogy, social work pedagogy. Please. How many of us are actually competent to get into those areas? The new normal, technically, how are we competent to manage the technology? And when you can use it, okay, conceptually, when are we clear about it actually? So there is a lot to do in-house. We need to improve a lot of our own internal capacities, social workers' capacities, especially in the new normal. Technology is going to be major things and we are not ready for that. And developing technology from a client-centered perspective. And a lot of technologies are there actually, it is mostly coming from the business organization's perspective, not from the technology client perspective. Or whatever apps you develop, we have a responsibility to ensure that, okay, the client's needs are actually getting focused, the consumer's needs are getting focused rather than the provider's level. There is a need to build resilience as an agenda in all our programs. Resilience is becoming the mantra at the moment. And we have been doing in the whole, working with the various disciplines, but we need to have more and more interactions, inter-sector collaborations and with the other sectors. We need to have a multidisciplinary approach. Social workers cannot isolate themselves from the rest of the things. So we need to have other groups. And there we need to have quite a lot of networking because the context in which we are operating is very complex. And we alone are not able to address those things. We need to have different actors, different stakeholders coming together to supporting us. So a multidisciplinary approach, probably we may have to work with ethnography, we may have to work with psychology, we may have to deal with the law. Now the technology, all these things are important. Now, of late, there is also a concept called green social work. I don't know how many of you are part of it, how many of you are associating with those processes. It is basically connecting social work with the whole environment. Disasters and environment were not seen as part of the social workers' action in the past. But disasters became an agenda probably in the last 10, 15 years. And last 5 years, probably there is a lot of interest even into getting involved in the environmental part of it actually. So social work also need to be green at the moment, We need to talk about the relationship between human beings and the environment, the humans and environment. You look at what happened probably in China. Where did we get it actually, even the virus? Because we managed poorly the environment there, the hygiene part of it actually. You look at Nipah, you look at any other disease, it's all coming from where? Because we don't have a proper link with our environment. So there is a need to have a green social work approach. Next. I mean, quite a lot of literature are there. I'm not getting into those things, but what I am suggesting is environment, ecosystems are important for us. We need to connect to them. And we need to see the link between ecosystems and environment, human being, and how we are influencing them or how they are influencing us we need to understand that part. Next, please. Please, next one. Next one, please. Yeah. So finally, I would like to bring 2-3 aspects. At one level, COVID-19 is changing the world and creating a normal. Normal is basically challenging or engaging, improving and transforming social work practices. It gives a lot of challenges. It challenges, questions us, and it offers opportunities. That's happening. And in a way, it is basically compelling the social work profession to change. And the question is, are we ready to change? I stop here. I'm happy to respond if there are questions. I hope I didn't bore you. Or
No, never, sir, never. Thank you very much. It was very thought-provoking session on the things we are facing or the misfortunes we are facing on the face of pandemics. And the question is very relevant. Are we ready to face the newest challenges of social work amidst of this usual, what we can say, usualities in the new normal world, I think. So, hello all. Dr. Aloysius was presenting the various aspects of emerging social work on the basis of the pandemic world, especially in the post-pandemic world. So, in this particular session, he was mentioning the various aspects of pandemics we have faced through the various misfortunes and communications. Then polarization happened in our society and the social isolations we faced. Then the various of social unrest and uncertainties, also of the privacy concerns. As he's telling, everything is become a everything life. So in a fast digitalizing world, our social work also cannot be go through offline. So online social work, the possibilities of online social work also was being discussed. This online social work is some way, it is ensuring the social connectedness and also the solidarity. But here we are again to address the digital inequalities we are facing amidst of this. Sure. And Dr. Aloysius was telling about the various emerging social practices regarding care and support, education and training on the basis of individual, group, and community levels by ensuring social change, social justice, then safety to life, then service accessibility, work-life balance, many things. And he was telling about the garden of balcony experience from Beijing too. So in a virtual world, how we can ensuring the social solidarity and this connectedness. He's challenging us also. Are we ready to face the changes? So to face that particular changes, we have to need certain shifts, especially in the social work practices. So he was concluding like this: to transform the social work practices, we have to change in make the changes in social systems and structures, and we have to definitely move out of our comfort zone. So here is the time to open up. You have many doubts and discussions. Now the platform is open for the discussion, and you may raise your questions directly, unmuting the mic, and also you can put your queries in chat box too. Please. Okay, Shamna.
Hello, sir.
Please.
Sir, I have a doubt. As Boban sir already mentioned, we are all know we are living with the pandemic, and as students we are going with the online classes. People have a perception that the students now are not fit for jobs as they're going through online classes and online exam, which people find which is not effectively working. So there are concerns from the student side that is, is there actually a hesitancy from the part of people to accommodate the COVID batch students, COVID batch students for the job, and how can we make up with our limitations?
Sarah, you are unmuted.
Can you come again? Sorry, I lost it in between.
Shamna, can you ask again the same?
Yes, sir. The people position for the COVID batch, they are not fit for the job, and the many interviews are calling except to the COVID batch and all. Then, is there any actually a hesitancy from the part of the people to accommodate COVID batch students, or is there anything? How can we make up our limitations?
I think this is one of the challenges not only social work students are facing, it's the all students are facing at the moment. And probably there is a general feeling that, okay, the batches of 20, batches of 21, or maybe batches of 22, they are not fit for any work because they are not studied anything. I mean, that is a general perception. I mean, the reasons are different actually. Maybe because they don't recognize the whole online classes, the importance, probably how it contributed. Or they feel that, okay, they are not able to pick up the appropriate skills needed as a social worker, all those. Or probably even as an engineer or even as a doctor. I hear a lot of comments like that, even how the doctors, how do they do it online? I mean, okay, when they're supposed to be dealing with the patients at home, in the hospitals actually. So there are things like that. I mean, I think this is a passing phase. I mean, we need to recognize that part at the moment. At the same time, equally, we may have to, if there are limitations in our skills and competencies, I think we may have to do it. I think there lies actually the role of maybe the whole social work organizations or associations or maybe social work colleges. How we can support the students who came out in 20 or 21 or probably doesn't have the appropriate skills. Maybe additional skill development programs, specific courses. So some of these things can be part of it actually. And if there is a collective effort for that one, I think definitely there will be people willing to support that one, organizations willing to support that one. Or it can be connected even with the national skill development programs. But is the social work colleges, social work associations, are we recognizing these limitations and are we ready for that one? I think that's a challenge. Sorry, Shabna, I don't have a direct answer to you, but I'm just trying to give you a larger perspective. Yeah.
Okay, sir. Thank you.
I've seen a question from Anju here. Could you please explain what are the direct client-centered technologies? Can we give it to clients? I mean, the whole focus is any technology. I mean, say, is it client-centered? From where does it come in? There is that power imbalance is there actually. I mean, when the client comes, whether our approach, whether that is getting reflected, social work approach, whether that is reflected in those technologies. I mean, our approach to social justice, whether it is getting reflected there. Or we give a lot of importance to persons, the dignity of persons, whether that is getting reflected there. So it is, how do you see that from that perspective? I think that's more important. So every technology can be made people-centered, client-centered. Not necessarily it has to happen from the other side.
Sir, there are one more question here. What's your opinion to tackle the ethical and moral dilemma during COVID pandemic?
It's a challenge. See, the whole question, I mean, we said we need to be professionally competent to deal with our clients. And when you do these sessions on through Slack or Zoom, do you know how to manage that too? So that's a challenge. We don't have a competency there, but still we are forced to get in that one. There is a moral dilemma, moral ethical question there actually. We are not competent there, but at the same time we are doing it because of the compulsion part of it. So that's happening. I think a lot of discussions are required at this level. See, the whole practice is also evolving. Probably some of the things what we thought probably 10 years back not relevant, at the moment it is becoming an issue at the moment. So we also need to change. Probably we may also have to look at our own ethical challenges or moral dilemmas, whether those moral dilemmas are really moral dilemmas at the moment.
Okay, sir, you were talking about the green social work approach. Actually, this is to remain as an approach, or we have to emerge it as a concentration in our curriculum?
I think this is an important agenda at the moment because we are talking about climate justice, we are talking about environmental refugees, we are talking about ecosystems and climate issue. At the moment, it is somewhere there very close to you. So whether the social work is also getting involved in that one. See, that's the trend of social work. No? Social work always try to, we come very late actually into these issues. Disaster, we came late. And now the climate change, where are we at the moment? Because we are comfortable at certain levels. But these are larger issues and we need to come at that level. So we need to be there at the green social work. How can you say no to that even to Kerala at the moment, green social work? Or it should be part of your agenda at the moment. It's not that something different. How do you bring in that connection between environment and social work in your programs, in your curriculums?
So participants? Sir, please. Vivek, sir.
Thank you, Bhuvan sir. Aloysious, thank you very much. The reflection that you made, I mean, I was thinking you are lucky to, I mean, because of this conference, I guess you got time to reflect on your experience of going through this COVID-19. And Aloysious, I was feeling that you're talking in my mind because, there's the same kind of thinking was going on in my mind too. Because being a practitioner, I don't know, students, I mean, they haven't worked, so most of these participants are students, they might find difficult to connect some of those things that you spoke, but at least as a practitioner, I was really able to connect whatever you were talking. So just that, the COVID-19 time, actually, like, our organization, we moved into remote mode. Like, it's interesting to see, like, my role as a global humanitarian manager, supporting all the countries around 35 countries in the world. But last 2 years, I haven't traveled anywhere. I was sitting at my home in Kerala in Payyanur and managing my job as a social worker. I mean, that we would not have imagined some time back, happening. Because, before COVID, 80-90% of my time, 90% of the year, I was outside. Like, I was not at home during that time. But now, 100% of the time, I'm at home and I'm managing. The things are happening. Program is running. There's no issues around the quality, everything. So people are getting used to that. We were getting used to that. But my point, questions to you, like, now, the COVID-19 case, everybody is, rushing to go back to the previous life because that is more interesting than what we are having currently, this talking to the screen mostly, not seeing people. I haven't seen my colleagues for the last 2 years. I haven't seen my office for the last 2 years. Just my office is my computer and this Teams, or the Google Meet or whatever. So people want to go back to the old normal life. And, but at the same time, we have a lot of advantage. Just an example, last 2 years, our travel budget, just for my department in my organization was zero travel budget. There used to be more than 1 or 2 million just for my department, 1 or 2 million pounds. So £3 lakh pound, 0 million, that's a big saving for the organization. and that money has gone back to the people on the community. That has gone directly to the people to support them. So that's an advantage. Like, we manage without traveling, and that money has been used to support people. So that is just because of COVID. Number travel that work has happened. So there's more money reaching to people. So there's a lot of advantage. And see, now Aloysious is here in this conference just because of this COVID and the system current new normal. Otherwise, he would not have been able to join here. And the same thing happens. We are attending so many seminars, conference, and we're getting a lot of opportunity for expanding our knowledge. And being yesterday, the lady who was there in the inaugural session, I don't know how you would be getting her online unless this is the COVID time. So we are going to settle down somewhere in between, because there are advantages, there is a disadvantage. So we'll go back to the old normal, and then we take advantage of the new normal benefits. Like, we might have a hybrid kind of model where we'll reduce. Definitely now we are talking of increasing the travel budget, just an example, increase the travel, but not to the extent that we had in the past. So it means maybe we'll teaching. We might absorb some of those good part of teaching online, and then going back to 50% of classroom training and field trainings. So it might happen into different sectors. Even IT people, you can see them. Some of them going back to their work, not always 100% from home. So maybe that's where we are heading to. I don't know what you think, Aloysious, like in terms of, especially I'm just thinking of my own sector, where the humanitarian or development sector, and that's where as a social worker, we are working there. So what do you think is going to happen? Like, COVID is not going to be there forever. Maybe next 1 or 2 years, we might see a lot of reduction in the case. And then people, even now, they are not much worried of COVID, and everybody is so happy to travel around. Even though there's COVID there, so it's fine, we can manage. So that is where we are, and the psychology is changing again. Maybe we'll get back to that kind of hybrid model. What do you think, Aloysious, is going to happen from your perspective, from your experience? I know even you yourself is getting ready to travel, pack your bag and run out of India. I know, after 2 years of sitting at home and supporting people. Yeah.
At one level, okay, there is a desire from my side, okay, but that doesn't mean, okay, it is going to change. I think we will continue like this. We are likely to have my own reading is, the new normal, basically, we are going to have a hybrid situation, a blend of both online and offline. We cannot avoid travels anymore. But at the same time, we cannot sit always at home. There is also a need to meet one-to-one level, face-to-face level. So there are situations where you may have to go and interact at that level. We are comfortable as we're sitting at the moment, okay, thinking that the quality of the work we see, probably 2 years back, it is the same as now. No, there is a difference in that one. Probably you may have to see what's happening there at the field level and probably give the proper direction part of it. So travel is going to be there, but not necessarily the way it is happening now. So it happened earlier. So it's going to be a hybrid situation. Even the whole teaching, that is going to be the trend actually. All teaching is going to completely change. A lot of money is getting invested on technology at the moment, especially for the courses. New technologies are coming. The whole office systems actually. You look at the number of apps at the moment coming up actually. Various platforms are created at the moment. And it's all coming from there is also a group benefiting out of all these things. It's not that, okay, we are saving certain money at one level, but at the same time now investing those money for technology part of it actually. It's because Christianity is there, okay, they are able to meet those technological challenges there. But it is not the same for a normal an NGO, a civil society organization at the grassroots level, because they cannot invest more on those things. Actually, they have to pay quite a lot of money on that one. So this digital inequality is also likely to come up even among the NGO sector also. NGO sector, even look at actually the platforms we use, or even in the computer, there are people actually, the pirated versions of Microsoft, so many people are still using it actually. So we may get into that kind of a mode also. But that is likely to happen. And we will have definitely, my reading is it's going to be a blended version, hybrid version. Any sector you take it, health. Health, we proved that, okay, we don't need to go to a hospital for certain things. And there are quite a lot of Apps are at the moment, groups are at the moment, which allows actually telemedicine. The whole monitoring of the patients, it can happen on a daily basis also. Even 2 times, 3 times in a day, we can do it. We can just remind you, you are not taking your medicine. Morning, afternoon, evening, all those things are possible.
Thanks, Aloysius. I know we are running out of time. Just to complement one more point, Aloysius here. I mean, for all of us, like what happened during COVID time, though I was sitting at my home, I know even at the peak of COVID, the lockdown, everything was happening. And we have a lot of civil society organizations, the grassroots level organization, our partners, I'm talking of Christian our own local NGO partner, they were on the ground. COVID in the peak they were walking, I mean, they were going to the community, talking to people, giving COVID messages, giving COVID relief. We ran a huge program during COVID. So it means people see that's the the crux of social work, that people to people interaction and the connection that we have at the ground level, that was happening. But as Aloysius said, they had a lesser capacity than Christian Aid as an international NGO. We have bigger capacity there. We have the resources. But for the local organization, they were not having enough resources, capacities to run but still they risked their own life, and with a lot of commitment, they implemented the program. That's what we have been appreciating. Now what happens for the benefit of the students who are here, like we are talking of localization, that's one of the big term in the whole sector. We are talking of localization. We realize that the local community are best placed to respond to an emergency or to work on the development work. So we don't want somebody from the UK sitting and dictating, okay, you do for Payyanur, this is what you need for Payyanur. No, me sitting in Payyanur, I know what I need, and I'm close to my community. I can go daily. I can make my programs here. So what we are doing, most of the organization, at least for us, we are promoting localization, where we want the local agency to take the lead of their own the work. So when we're talking of those resources, the gap divide between the bigger agencies and smaller NGOs on the local level. So just give an example. One of the things what we are doing as Christian Aid. See, now for Ukraine crisis is happening. And we raised yesterday, just for DEC, for information, Aloysius, we raised almost 200 million pounds just with DEC, Disasters Emergency Committee. One of the fundraising appeal mechanism we raised 200 million pounds. So almost like 2,000 crore just within 1 or 2 weeks of the crisis. So huge funding coming in. Now we are looking at, and most of the organizations are not working there in the European, in that part of Europe. So we are struggling to spend the money, because struggling in spending is not just you go and throw the money. So you need to spend the money with this like effectively. And we have to make sure all the quality standards are met. So what we are talking now is of localization. We want, so we have local NGOs working there. And what we are doing, Aloysius, we decided is one of the, radical kind of thing. Like we are giving 10% of our indirect cost. 10% of the budget, overall budget, the local NGO, unconditional. So if, for example, if I'm funding a local NGO with 10 crore rupees, they'll be getting 10% of it, unconditional, just for the organizational development and setting up their own infrastructure. So that is something like, Christian Aid, we are getting, say, for example, if we run a program, we'll get 7% of the overall cost. If you have, 1 million budget from our donor, we get 7% as an indirect cost for Christian Aid. So what we're going to do, we share it 50% with the local NGO who is implementing it. So it means they'll get a, lump sum money that they can use for, investing on technology, investing on the resources, investing on their own infrastructure. So the local capacity is built. So what the point here is that, this is something that, some of the organizations are trying to make sure the local NGOs are well positioned to, work in the new normal, in this kind of a COVID situation, or in the longer term, and promoting localization agenda. Yeah, I'm just stopping it here. It's a huge interesting topic to discuss, especially with a person like Aloysius who has been into this whole thing. So yeah, I'll give the opportunity for children to ask questions if at all you have. You can see some comments also on the chat box. Thanks.
Thank you, Vivek sir. I think the
I just want to quickly respond to that one also, basically adding a bit into that one itself. I think here is actually an opportunity for social work colleges. Do you you want to exploit this opportunity, this localization and building capacities, local NGOs, civil society organizations, improving the quality of the students, especially using technology part of it. So you need to look differently from your current course, and probably this could be an extra additional work for you. You may charge for you. You can contact actually Christian Aid even to support that kind of things. Now here I'm not saying Christian Aid alone, but organization to support that kind of a process, because that is going to be the need at the moment, and it's going to be the opportunity for the colleges also.
Okay, thank you, Vivek sir. I think the participants also may be happy to know more about you. Could you just introduce yourself, please?
Sorry for that. I'm just an alumni of social work department of Payyanur Center.
Oh,
I was the
okay.
second batch of social work, MSW batch. And I'm from Payyanur only, it's nearby. And all the teachers, the centers are my, contemporaries in social work, my friends as well. So, yeah. Currently, I work for an organization called Christian Aid. It's an international NGO based in UK. So we work in Africa, Asia, Latin America, etc. And I work as a senior global humanitarian manager for the Asia and Middle East, supporting our all the humanitarian work, heading the humanitarian division for the region. So currently home based at home. Yeah.
Okay, sir. Thank you. And I
Bhuvan,
think
sir, since you asked, I would just add that it's Dr. Vivek who supported our Episteme 2022 to identify all the resource persons, eminent resource persons like Aloysious, Johnny, and all those who will be speaking here.
Okay, sir.
He's our alumni and he's been a great support all the time.
Okay,
Thank you.
thank
Continue.
you. Thank you, Vivek sir. And I think, Aloysious sir, we can take 2 more questions, right?
Just to say that I don't know whether when we introduced you missed it. Aloysious is a social work, alumni of Rajagiri College, right? Aloysious.
Yeah.
Already introduced.
Okay, thank you.
Okay, Krishna is asking, sir, I would like to ask you that we know we are looking into the social work practice and perspectives of a practitioner. So, sir, the mind of a common man to a change will be very different. So, the responsibility of a social worker is here, high here. I wanted to know what kind of an approach or the interventions as a social worker we could use in this new normal society.
I think the whole question is actually, you want to be a manager or you want to be a facilitator? There are 2 ways looking at actually. People, change has to happen within. You cannot force change actually. So you need to allow the people to think about it and look at the opportunities and then to make changes. So your role, probably your social worker's role, is basically to facilitate that process, enable that person to make that kind of a decisions actually. Okay, at certain conditions, certain times, okay, you may have to do it. Probably forcefully certain things. You need to have a sanitize, maybe your face mask or you need to have a sanitization. All those things, and those are people, they don't want to change. But certain conditions are there, okay, you need to do it during these times. Okay, fine. But ultimately, you need to help that person to understand. See, if you don't put your mask, if you don't sanitize yourself, you are not only creating problem for others, but also problem for you. So that helps that person to make a decision, okay, whether I need to use a mask again. So facilitating that process is more important for the social worker rather than actually giving top-down approaches. A top-down approach may remain only for some time, but then once the police is not there, okay, things can go back to the same situation. So that policing is not possible from a social worker's point of view. Recognize the person as he is. I think that is what the social work profession says.
So one more question from Akila here. Return to normality is a major challenge in this situation. It was an unexpected pandemic, so the world was not prepared for. But there has to be a clear strategies to address the physical, mental. I think, Akila, could you just unmute and ask what is your query? It's okay. Yeah.
Okay, sir. Good morning.
Good morning. Please ask.
Sir, okay. My question is that, sir, return to normality, we are talking about the challenges and opportunities in this new normal society, So while we are looking for the return to normality, it is a major challenge in this situation. So and also the world is not prepared for how to overcome this situation. So but there has to be a clear strategies to address some the vulnerable people's problem, like the physical, mental, financial and emotional needs of children, adult, all the people, all age and all their families also. So but it is very difficult to stay in contact with people individually, because we are giving only the telephonic counseling or we are using the online platform and all. So it is not possible to give intervention directly in some ways. So the social workers facing many of such struggles also, like if we need to address the dignity, what all those things, but the social workers facing many of such ethical struggles too. So as a practitioner, sir is sharing some interventions in such a way. So could you please share more about it? That was my question.
Yeah, let me tell you, we are not going back to the normal. I mean, the old city start from this one. The water is already started flowing in the river, and that water cannot go back because it's flowing. So that is one level. So this is again a new challenge. We never worked at that level actually. So we need to find the solutions at our own level. I'll go back to what probably Vivek was saying. How do we look at actually the whole localization part of it? Not necessary that, okay, a social worker probably from another village need to do all these things. So we have, if you look at the health part of it, actually, we have the Asha workers. What is the role of an Asha worker? Asha worker is basically following with the 10 families or 20 families or 100 families there actually. It's very small group actually for her to cover. So we may have to think about different methodologies or strategies to reach out to those people, especially the women, especially the elderly people, probably the children part of it actually. There is no one answer for any of it. The context is very important. How we operate is very important. So we may have to find our own solutions when we work at that level. So a lot of analysis, reflections from a local context is important, how we can do it. A lot of examples are there actually, but we can talk about it at a later stage. Yeah.
So one more question from Norwin.
Things are still evolving. Yeah, I saw that.
Yeah.
Norwin, I saw the question. I can address that one. You see there? Yeah.
Yeah.
My response is something like this. In UK and US, the way social work is understood is different from the way social work is understood here. There it is mostly coming from a care worker's point of view. So they are there to provide basic care. There are specific focus on children, women, or probably elderly, all those things. The social workers, they are basically approved social workers there, and they are focusing only on certain areas. Whereas in our context, it is a bit more of a generic, and it is mostly on, okay, we do a lot of family welfare counseling and all those things, but at the same time, there is a lot more focus on community development, community organization process. So the type of work they do and we do are slightly different. So it is important, where do you want to be there? Okay, in an institutional context, okay, at one level, there's a lot of acceptance, but at the same time, working with the community, working with the people, developing those people, enabling them, empowering them, there is also another dimension. So we need to choose.
Okay, sir, I think there are no more queries and it is about to finish also. So I am so happy to be with you to share this particular session, and it is of immense pleasure. And as Dr. Aloysious indicated, to achieve a lasting impact or to bring profound changes in people's lives, social work has to go miles and miles again. And for this purpose, we need to employ scientifically proven methods which is built on robust data and multidisciplinary approaches. Sure, and we are ready to face that particular question. Are we ready to change and to face the challenges? Right here, I am addressing this particular thing, the relevance of global connectedness and social solidarity. And the Episteme Season 3 surely offer a strong step towards this one, I think. I'm so happy to be a part of this international event. And also, I thank to you, Dr. Aloysious. Also, I'm thanking wholeheartedly to the organizers for Anitha Miss especially, and Dr. Sunil Lemon, and also Achmila, and all other student organizers for inviting me to chair this one. Thank you, and all. Thank you, sir.
Thank you. And from my side, I think it's a good opportunity to associate with this international workshop, with the college and also with the students. And also like to offer, from my side, one is a suggestion. As an outcome of this conference, why did you take up some of these issues as part of your college agenda, as part of your probably social work professions agenda? You have the Social Workers Association there, and try to respond to some of those challenges emerging at the moment. In case you need any support on those things, definitely I'm there. I'm offering my support for that one, because I'm also concerned about actually enhancing the status of the social work profession and also building up the capacities of the students and also maybe the professionals in that one. It's a payback time from that perspective. So thanks, Anitha and Vivek, and also all the students. Thanks, Professor Boban, actually moderating and probably accommodating my views.
Thank you, sir. Thank you very much.
Thank you, Aloysious, sir, for that offer. We will surely take advantage of that. We'll keep in touch.
Okay. Thank you all. Thank you. And over to you, Ajmila.
Thank you, Boban sir, for moderating the session. Now I invite Adnan Altaf to deliver the word of thanks.
Good afternoon, everyone present here. Honorable Chief Guest, Mr. Aloysious James, Development and Humanitarian Professional. Dr. Anitha A., Teacher in Charge, Department of Social Work, and all the faculties of Department of Social Work and all the valuable participants of this session. It is such an honor for me to get the opportunity to deliver the vote of thanks on behalf of the Department of Social Work, Sri Sankaracharya, University of Sanskrit, Kaldi, Regional Campus, Payyanur. I extend a sincere gratitude to our resource person, Mr. Aloysious James, for his valuable session. He gave us an update on a global COVID scenario, the impact of COVID-19, the mental health problems we faced, the social stigmas, the valiant effort these social workers have took, even though we were unprepared for it. The tele-era we are now facing, from the tele-healthcare to the tele-work, to tele-medicines, to tele-justice, and to education. Also, the emerging social practices for the care and support to the mental health support programs. Also, the challenges we experience from the ethical dilemmas, and also the shifts we need to survive, like the shifts needed in social work practices. Like we must move out of our comfort zone to become a change and be ready for the future, for climate changes and other such challenges. The need of green social work is real. Thank you for your knowledgeable session, sir. From the part of the Episteme team, we would like to extend a special thanks to Dr. Vivek, our alumni and humanitarian professional, for joining us and enriching our session with his experience and inputs. I owe my gratitude to all the other faculties, research scholars, and students of various universities and colleges who have been through the session. Thank you once again. I convey my heartfelt gratitude to you all. Thank you.
Thank you.
Thank you, Adnan. We are coming to the end of the session. I convey my gratitude to all who joined with us. And I convey my regards to Boban Sir, the Assistant Professor of Department of Social Work, Sri Sankaracharya University of Sanskrit, Kaladi, to moderate with the session. Thank you all.
Thank you.
We have next session for paper presentation at 2 o'clock and the thematic presentation at 7:30 p.m. Hope you all will join with us. Thank you.
Thank you.
Thank you
all.
so much, Dr. Aloysious, and Dr. Boban. Thank you so much, Boban, for joining us.
Thank you. Thank you, Miss. Thank you,
Thank you.
Alexa.
Yeah.
See you
Correct.
then.
Yeah.
Sure.